With COVID-19 more likely to become an endemic, as mentioned by the World Health Organization, a different approach and thinking may be required to tackle it. We asked Catherine Bennett, public health expert at Deakin University, Melbourne, about safeguarding both lives and livelihoods in our long-term strategy to manage COVID-19.
I think the sense in part of the population is, well, we can just keep doing this forever. And the reality is we can't. And every lockdown is, another blow to the economy, and it's already weakened. So you're just making it worse every time you keep sliding into these new outbreaks, these new response needs, stopping all of your internal domestic travel as well as keeping your international borders closed. So I think we need to both get more precise with the way we intervene to contain the virus. That should get easier again as the vaccine levels start to lift in the community and we are in a safer backdrop. But also we need to be setting targets for the community so they're not just waiting around till next year, but they know that vaccines mean we will open up the borders, and they know when the aim is to have that and when vaccines will be available to everyone in the country. So then the expectation is on them to make the bookings, not just on the government to fix it all.
She added that while many countries are focused on preventing deaths from COVID, there needs to be a wider conversation on the deaths of livelihoods.
I think that's the hard conversation. People aren't going to say any deaths are acceptable, but at the same time we can't maintain what we have. So the conversation needs to shift to how many deaths we can prevent, and to go back to where we started with all of this and say we will put all these things in place, because this temporary measure, which is proving incredibly hard to maintain in all countries that have got to zero, you just cannot hold it unless you are completely closed off from the world. So I think we now have to just focus on doing everything we can to protect and make for a resilient population, particularly with those most at risk of serious illness and death. And that's what focus the conversation on, and not to treat it differently once we get to that point.